there are different types of ear infections. There's inner ear infections, which I was just talking about with the ear tubes in there. And then there's outer ear infections or swimmer's ear. So swimmer's ear is usually related to, getting water in your ear, using Q-tips, which can traumatize the ear. So and that's usually incredibly painful. The ear will swell shut. They'll have drainage from the ear, pus or blood tinge discharge. So for outer ear infections, it definitely can be impacted by, swimming pools. Most people don't have any issues with that because the body's own defense mechanism helps us with it. The water gets in the ear and it goes out. Earwax is actually protective against ear infections from there. But if you get chronic swimmer's ear or outer ear infections, then probably it's beneficial to put earplugs in the ear when you are going to go and swim. If you do have the infection, antibiotic ear drops are the best treatment for that. If it's very intense, then usually they'll come and see us and we can help put in a little temporary sponge to help keep the ear open. But as far as most people do well without having the outer ear infections. If you are prone to having those, then earplugs are usually beneficial. And then there is when children that have ear tubes in place, there's a lot of talk about if they have the ear tubes in place, which has a hole opening into the middle ear, whether or not you need to use earplugs in that situation. And usually there are some people who say they need earplugs every time the children go in the water. There are other people who don't say you don't need to use them at all. I usually say if you're in a chlorinated pool, in the bathtub, or in the ocean where it's salt water and the water moves, that you can, especially with younger kids who don't dive down deep to cause pressure changes, you can, just have them play and be in the water normally. About 3% of kids with ear tubes will get chronic infections and drainage when they get their ears wet. Then it would be warranted to put tubes in when they're out, playing in the water or being in the water. I do recommend if you're in a pond or a lake where the water is a little bit dirtier and it's a little bit stagnant and you have ear tubes in, I do recommend earplugs for that dirtier water because you don't want to get it in deep. And if you are more of a competitive swimmer or you're diving down deep, then the earplugs are beneficial. So usually the earplugs are for people who get recurrent infections, dirtier water from that aspect. But if you swim in the water, in the ocean, in the pool, and you never have a problem, sometimes just leaving alone is the best thing because your body has its own defense mechanisms.
Okay, that's great.